Benzocaine is a local anesthetic gel that is used for short-term relief of pain from minor mouth problems such as toothache, canker sores, sore gums/throat, and mouth/gum injuries. It works by numbing the painful area. It is important not to use this product for children younger than 2 years due to the risk of serious side effects. It's best to consult your doctor for more details on the appropriate use of this medication. Make sure to always follow the instructions on the product package or as directed by your doctor. If you have any questions, don't hesitate to ask your doctor or pharmacist for clarification. Only use this medication up to 4 times a day unless your doctor tells you otherwise. Allow the medication to stay on the painful area for at least 1 minute before spitting out or rinsing your mouth. It's important not to use too much of this medication or use it more often than directed, as this can increase the risk of serious side effects. Avoid getting the medication in your eyes, and if you experience severe sore throat lasting more than 2 days, sore mouth symptoms lasting more than 7 days, or any other concerning symptoms like fever, headache, rash, swelling, nausea, or vomiting, stop using the medication and contact your doctor. If your condition persists or worsens, seek medical help immediately. Some people may experience a slight burning, tingling, or stinging sensation when using anesthetic gel. If these effects persist or become worse, it's important to notify your doctor or pharmacist. It's important to remember that if your doctor has prescribed this medication for you, they have determined that the benefits outweigh the potential risks. Most people using this medication do not experience serious side effects. In rare cases, this medication may cause a very serious blood disorder called methemoglobinemia, which can be fatal. This is more likely to occur in people with breathing problems, certain blood diseases, or those who smoke. Symptoms of methemoglobinemia can occur within minutes to hours after using the medication, so it's crucial to stop using it and seek medical help immediately if you experience symptoms such as pale, bluish, or gray skin, unusual tiredness, shortness of breath, fast heartbeat, dizziness, headache, or confusion. While a serious allergic reaction to this medication is rare, it's important to seek medical help right away if you notice symptoms such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or difficulty breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, it's important to contact your doctor or pharmacist. As for the best time to take this medication, it's essential to follow your doctor's instructions. If you have any concerns about the daily dosage or timing of this medication, be sure to discuss them with your healthcare provider. Before using anesthetic gel, make sure to talk to your doctor or pharmacist if you have any allergies or certain health conditions such as heart disease, blood disorders, or breathing problems. Also, let your doctor or dentist know about all the products you are using before having surgery. If you are pregnant or breastfeeding, it's important to discuss the risks and benefits with your doctor before using this product. Always consult with your healthcare provider for specific concerns about using anesthetic gel. When using anesthetic gel, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. This will ensure that you are using anesthetic gel safely and effectively. If someone has taken too much anesthetic gel and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the Poison Control Center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of anesthetic gel overdose may include slow or shallow breathing, seizures, and irregular heartbeat. Make sure to keep all your scheduled medical and lab appointments to ensure that the anesthetic gel is working effectively for you. It's important to follow up with your healthcare provider to monitor your progress and make any necessary adjustments to your treatment plan. Anesthetic gel is a type of medication that is used to numb the skin or the surfaces inside the body. It is commonly used before medical procedures such as injections, skin surgeries, or minor dental procedures. This gel works by blocking the nerve signals in the body, which helps to reduce the feeling of pain or discomfort during the procedure. It is important to follow the instructions provided by your healthcare provider or on the product label. Typically, anesthetic gel is applied to the area that needs to be numbed, and the dosage and timing may vary depending on the specific procedure and individual needs. It is important to consult with your healthcare provider to determine the best timing for using anesthetic gel before your procedure. It's important to store anesthetic gel at room temperature, away from light and moisture. Avoid storing it in the bathroom and make sure to keep it out of reach of children and pets. When it comes to getting rid of the gel, don't flush it down the toilet or pour it into a drain unless you're specifically told to do so. Instead, properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.